This is the model of a spinal cord showing the arterial supply and the venous drainage of the spinal cord. This is the horizontal section of the spinal cord. A spinal cord, we all know, is a 45 centimeter long tubular structure lying within the vertebral canal up to the L1 level, occupy the upper two-thirds of the vertebral column and inset around by the three layer, that is the durameter, three meninges, that is the durameter, arachnoid meter, and the pachymeter, durameter, arachnoid meter, and the pachymeter from outside in. Okay, and it is made up of neurons. And if we look at the horizontal section of the spinal cord, what we will see that in the center there is a butterfly shaped gray matter. This is our gray matter. This is the anterior horn, the lateral horn, and the posterior horn. This is the central canal. This is the white matter, which is made up of axons and the dendrons, and these are all cell body of the neurons. And this is anterior funiculus. Here is the lateral funiculus, and this is the posterior funiculus. This is the anterior median fissure. This is the posterior median sulcus. And this two, this one, and this one. Here is the two anterolateral sulcus, and here is the two posterolateral sulcus. Here and here is the two posterolateral sulcus, and this is the median sulcus. Okay, it is very necessary to know about this sulcus and the fissure, because in which the spinal arteries and the vein runs. So now coming to the arterial supply of the spinal cord, it is by the vertical arteries and the horizontal artery. Vertical artery is the anti-spinal artery, one in number, and the two posterior spinal artery. Anterior spinal artery, just start with the heart. This is the heart, and this is ascending aorta, arch of aorta. This is descending thoracic aorta. From the arch of aorta, this is the brachiocephalic trunk, again divided into common carotid and the subclavian in the right side. In the left side is the subclavian, is the direct branch from the arch of aorta. From the subclavian artery, the vertebral artery arises. Vertebral artery. It passes through the foramen transversorium of the cervical vertebra, and then vertebral artery enter inside the foramen magnum, going to the cranial cavity. This is the foramen magnum level of, and it is within the cranial cavity. This is the basilar artery, which runs in the basilar sulcus of the pons. So these two are the vertebral artery. The vertebral artery, the branches is, and this is the spinal branch. A spinal branch of the vertebral artery from V4 of the vertebral artery, V1, V2, V3, V4. There are four parts of the vertebral artery. From V4, it is the spinal branch. Both spinal branch unite to form the anterior spinal artery, shown by this grey color wire, which runs in the anterior median fissure throughout its whole length. Okay, throughout its whole length it runs. Okay, and there are two posterior spinal artery. Posterior spinal artery, this is again the branch of the vertebral artery, and in some time it is the branch of the posterior inferior cerebellar artery, which itself a branch of vertebral artery. So posterior spinal artery, it runs in the posterolateral sulcus. Okay, there are two posterior spinal artery and along the whole length. Now coming to the horizontal arteries. Horizontal arteries are the segmental artery. This yellow wire, this was the segmental artery of different level. From cranial to caudal, if we move, then it is the segmental artery is the branch given by From cranial to caudal, it is posterior inferior cerebellar artery, vertebral artery, PV, then CIL. C for cervical. It is deep cervical and the ascending cervical. Segmental arteries is the reinforcing branch which is given by this yellow one, given by from cranial to caudal. It is the branch of posterior inferior cerebellar artery, vertebral artery, then deep cervical. Deep cervical is the branch of costocervical trunk. Ascending cervical, which is the branch of thyrocervical trunk. Then 2I, that is the superior intercostal and the posterior intercostal. Superior intercostal is the branch of the costocervical trunk, and the posterior intercostal is the branch of the descending thoracic aorta. And then 2L. One L is lumbar artery, is the branch of the abdominal aorta, and another L is the lateral sacral artery, which is the branch of the internal iliac artery. So, all these which I have said is the artery which are supplying this segmental artery, this yellow one. This yellow one, it divides into two. There is the anterior spinal medullary artery, and the posterior spinal medullary artery. This segmental artery, you can see here, this segmental artery, it enter inside the vertebral canal through the intervertebral foramina along with the spinal nerve. And this is in white color, this is the spinal nerve, and this is the anterior root of the spinal nerve or ventral root, and this is the dorsal root, this is the dorsal root ganglia. So this is anterior root and this is posterior root, and this is the segmental artery which gives anterior spinal medullary artery. At this one is the anterior spinal medullary, again this one, all throughout. This reinforces the anterior spinal artery. This gray one is the anterior spinal artery, which is reinforced by this segmental arteries. Okay, and it also gives, this is the segmental artery gives anterior spinal medullary as well as the anterior radicular artery. Radicular means root. It goes along with the anterior nerve root. So anterior radicular. This is posterior radicular artery along with the posterior spinal medullary, and this is posterior radicular which enters along with the nerve root. This is posterior nerve root. So this is posterior radicular artery. All these arteries on the surface of the spinal segment, this form the pile plexus of arteries. And one thing, that is the anterior spinal artery in the sulcus, this is the sulcal artery. It gives sulcal artery along the sulcus, and this is the circumferential artery. These are the branches of the anterior spinal artery given in each spinal segment. Sulcal artery, this is the circumferential artery. So, and all, as well as this posterior spinal artery, it also gives sulcal artery and the circumferential artery, which I have not shown. So, the anterior spinal artery, posterior spinal artery, sulcal artery, circumferential artery, anterior spinal medullary artery, anterior radicular artery, posterior spinal medullary artery, posterior radicular artery, all these form the pile plexus of artery. Okay, and this segmental artery, this is 12 in number in the anterior aspect, and approximately, and in the posterior, which is going to reinforce the posterior spinal artery, only 8 to 9 in number. Okay, and the segmental artery at the level of T11, or you can say roughly from T9 to L1, at any level from T9 to L1, mostly at T11, and at the left side only there is a voluminous artery which is only reinforcing. This is the big artery which going to supply only, going to reinforce, okay, going to reinforce anterior spinal artery, not posterior spinal artery, only the anterior spinal artery. This is artery of Adam Kai Wiggs, artery of Adam, A-D-A-M, Adam Kai, K-I-E, Wiggs, W-I-C-Z, after the name of the scientist, and it is at the level of T11, mostly at the left side only. Okay, and the anterior spinal artery supply anterior 2/3 of the spinal cord, whereas the posterior spinal artery supply posterior 1/3 of the spinal cord. Okay. Now this anterior and the posterior spinal artery at the lowermost level of the spinal cord, that is the conus medullaris, it forms the cruciate anastomosis, unite to form cruciate anastomosis. Okay. Now coming to the vein, there are 6 longitudinal vein are shown by this black color wire. Okay, this is the running in the anterior median fissure. There are 2 median vein. This is anterior median vein, and in the posterior median sulcus, this is the posterior median vein, and 2 in the posterolateral sulcus and 2 in the anterolateral sulcus. 2 in the anterolateral sulcus. Okay, this one here is one is drawn here. This is in the anterolateral sulcus. The position is fixed. The vein position is fixed, that it lies posterior to the nerve root. Here in the anteriorly it lies posterior to the anterior nerve root, and here it lies posterior to the posterior nerve root. So there are 6 longitudinal veins which runs in the sulcus and the fissure of the spinal cord in whole length, and it finally drains into the internal vertebral venous plexus. An internal vertebral venous plexus which lies in the epidural space. Epidural space, that is outside the durameter but within the vertebral canal. Okay, and then it finally drains into the basilar venous plexus, and the posterior intercostal vein and the lumbar vein, lateral sacral vein, all these drain into the internal vertebral venous plexus. Okay, now about the clinical significance, the most common is the anterior spinal artery occlusion, in which the anterior spinal artery, this is occluded, and it is going to, as we know, it supplies the anterior 2/3 of the spinal cord. At this level only the anterior 2/3 of the spinal cord. And here is the site of the corticospinal tract, the anterior spinocerebellar, posterior spinocerebellar, lateral spinothalamic. Here is the anterior spinothalamic tract. All these are coming from the brain, and these are the site at the horizontal section of the spinal cord. Okay, this anterior spinothalamic tract, these are for the touch and pressure, whereas the lateral spinothalamic tract is for the pain, temperature, and so these are, and corticospinal tract, this is motor, that at the level of the lesion there will be lower motor neuron type of lesion. At the level of the occlusion of the anterior spinal artery, at that level there will be lower motor neuron type of lesion, and below that there will be upper motor. because inhibition made by the corticospinal tract is lost below that level. And one thing is worth mentioning, that the posterior column sensation will be intact in anterior spinal artery occlusion. Here is the fine sensation, that is the touch pressure, fine touch pressure, vibration, 2-point discrimination, conscious proprioception. All these are by the dorsal column, posterior column sensation. So this will be intact, and there will be lower motor neuron at the level, and below there will be upper motor neuron due to the corticospinal tract involvement and the loss of pain, touch, temperature, and unconscious proprioception, which is carried by the spinocerebellar tract. So this is all about the arterial supply and the venous drainage of the spinal cord. Thank you.